Hi, I'm Paul with Vida Health Spa. This is my nurse practitioner, Katie Coffman.
Hey everybody, I'm Katie. I'm a health and wellness nurse practitioner at Vida Health Wellness, and today we're going to answer a bunch of questions that you guys may all have about what we do here in the office.
We're going to talk testosterone therapy replacement. So, Katie, what is the biggest misconception about testosterone replacement therapy? Why people are scared of it, the side effects, the benefits, all that good stuff?
It's a great question, Paul. Let's first explain what TRT is, testosterone replacement therapy. We refer to that as TRT in our clinic, and we have had so many patients have awesome results from it. But to start with, what are the myths of TRT? Why is everybody scared of starting on testosterone? There are so many common misconceptions of what TRT can do to a man, what you can feel like if you start it. So we're going to debunk a couple different myths here. So will I be infertile if I start on TRT? Does TRT reduce my sperm count? Will I not be able to have children? Will I be at risk for not being able to have children later on in my life? We are going to get to all of this. So let's first start with what TRT is. Testosterone replacement therapy is giving your body back the testosterone that you may have had decrease over time. As a natural process of aging, men lose testosterone as they age. Your sperm count may go down, your fatigue may increase, you may have a loss of libido, loss of energy. Everything just starts to go downhill as you age. So what we like to educate our patients on is replenishing that. Optimizing your testosterone level is going to help give all of that stuff back to you that you may be missing out on as you're naturally aging.
So tell me more about doing the shots and injection of testosterone versus the more natural enclomiphene, why guys under 30 shouldn't do shots and they should do enclomiphene. Let's cover that.
So that's a really good question. So should you start on TRT or testosterone replacement therapy, or should you start on enclomiphene? So this is a great question that we like to educate our patients on. If you're a young guy who still wants to have kids, you may be feeling a couple symptoms of low T, we will educate you on why enclomiphene might be a great option for you. Enclomiphene is going to help keep your sperm count high, it's going to help prevent infertility, and it's going to give you those benefits that you may need with testosterone more naturally by boosting your natural production of testosterone. So we always like to educate our patients on the different routes. We will not steer you in the wrong direction or make a decision for you. Rather, we will help you come up with the best option for yourself.
Great. What about as far as doing testosterone injections?
Testosterone injections is a great option for men that requires very minimal work. So what we do is we're gonna have you come in once a week, get your shot. We're gonna manage everything for you. So we're gonna manage your blood work. We're gonna manage your vitals. We're gonna manage your symptoms. We're gonna make sure you're getting all the therapeutic benefits that you need to get from TRT while managing any harmful or bad side effects that one may have.
How does one qualify for TRT though? That's the big question we always get. So how can I get TRT? Do I need TRT? How do I know if I need TRT?
Qualifications for TRT. So how you're going to qualify to start on TRT in our clinic is you're going to come in and get blood work. So we're going to see what your starting labs are. We love to get baseline labs for all of our patients, see what you're starting with so we know how to come up with a treatment plan for you. So for TRT, you need to qualify to start. Not anybody off the street can just start coming into our clinic and getting injections. We need to make sure first that you're actually deficient in testosterone before we initiate therapy. So coming in, getting blood work, and getting our baseline labs is the first way that we're going to decide what you would qualify for and decide what treatment plan we're going to come up for you.
Great. What about side effects? What's the biggest side effect of testosterone replacement? Let's just say injections and enclomiphene, because there are some side effects in enclomiphene. Like, what's the variance of each?
So many patients may be worried to start on testosterone thinking, am I going to lose my hair? Am I going to become infertile? Am I going to have high blood pressure? So one thing I always like to say is we are going to manage everything for you here in the clinic. Everything that we give you is going to be beneficial for a therapeutic response for you. So we're going to make sure that you're not having any bad side effects, and we're going to manage them if you are. For example, testosterone may increase your blood pressure. So we manage patients' blood pressures here in the clinic. We make sure that their blood's not getting too viscous while they're here or on TRT, and we will know how to decide this and what if it's good for you or if we need to go a different route. So technically, any side effects that you may be getting on this are going to be managed here through the clinic.
What about estrogen issues? Does every patient need to take antiestrogens, or is that something that's only needed for some people and not others? I know that's another big concern with patients and getting the bitch tits, that name out there, because that's the number one people say, oh, I don't want to get Bitch tits.
Yes. So I hear this question a lot in the office. Am I going to get that? What am I going to do if I get nipple pain, nipple sensitivity? So I always like to educate my patients. If I'm giving you testosterone, it has the same relationship as estrogen. So if I give my patient testosterone and it increases, it can naturally increase your estrogen as well. So this is an expected response of your blood work when you're starting testosterone replacement therapy. But we're not just going to leave you high and dry with that. If you are having symptoms of high estrogen, such as irritability, moodiness, nipple sensitivity, anything that seems out of range, we will draw labs, see where you're at, and then we can always start with an anti-estrogen to help manage those symptoms.
Great. All right. Well, if I take TRT, another question people are going to say, am I going to look like Arnold? Am I going to get jacked? That's another thing that people always say. What am I going to look like? Am I going to get lean? Am I going to get really muscular? Is my wife going to love you more? What's the, what do you think about that? Those questions.
So you are not going to look like Arnold Schwarzenegger if you start on TRT, especially in my clinic here, our clinic here. We are going to be doing this very safely and in safe ranges. That's going to be the best for our patients and for their blood work and their labs. We want to optimize your numbers here. That's the number one goal of our clinic here is we want to optimize our patients' labs, make sure they're feeling the best as possible. That would be a disservice if I'm giving my patients a crazy amount of milligrams of testosterone so they can look like Arnold. I want to do this in a safe way. So please come to me. If you're trying to look like Arnold and it's not happening, you may be doing this unsafe and I would like to manage you. So please come to me. So a lot of our patients here, I feel like they're all coming in with the same complaints. So a lot of them are having like similar kind of difficulties in their life. A lot of them are middle-aged men who are just not feeling the same like they used to in their 20s. Like, what would you say about that?
Yeah, I think a lot of people that come in patient-wise are, the number one thing I hear from them is, I'm tired, or
the 2 o'clock like nap, the
correct,
2 p.m. nap.
Their stomach, their fat stomach, like they can't get rid of their belly fat. Or what do you think? Their libido. A lot of guys with libido issues.
Definitely.
Yeah, I think that's the top three. I think the tired thing is the most we get is, I'm just so tired. I got it today from somebody like, I'm so tired, Paul. Like, what can I do? And I'm like, well, you got to get your labs done. And then he did get his labs done, and guess what? His testosterone was like 212 or something in that area, and his free testosterone was 5. I'm like, well, dude, you got to go on test. Let's go.
Completely tanked. So it's as easy as that. Like just coming in, getting your baseline, seeing where you're at. And
correct.
and these problems really are being fixed. Like our patients that have been on testosterone, we do a recheck of labs. Every 6 weeks while your body's still getting started in the replacement process, we're rechecking your labs to see how your body is responding. We'll initially see large increases in these numbers. So the free testosterone is at least going up 5 to 10 points, with totals going up to 200 or 300 more than their baseline. So we're seeing bodies' responses to this really quickly and really well.
Yeah, and I know, like personally, and you treat me, even though I'm the owner, you treat me. My testosterone was under 200, and I think my last blood test I was 1100, which is on the higher end, and I think my free testosterone was in the 20s, which is perfect for me. It's a huge difference from me in the gym, for libido, for just overall feeling,
Energy's been way better. Mood.
My energy's way better. My mood, for me, yeah, it's great.
I think a lot of people forget about mental clarity as well.
For sure.
So like fogginess with low testosterone, super common to describe. Your mind is just not as sharp. Do you feel like you've seen a difference while being on testosterone?
Oh, absolutely. The only thing that it does, my estrogen does get elevated, and I can tell when it's elevated. I don't even need blood work because I can tell, like, all right, I'm a little irritated. I got some acne on my neck, or I get a pimple here and there, and I'm like, all right, I'm flaring up, like, or my nipple hurts. So I can tell right away I need an anti-estrogen, but otherwise I feel great.
Some people aren't as in tune with their bodies as you are.
Yeah.
So if you're one of those people that just may not be as in tune with yourself, labs are really what's going to decide, what's going on internally. And then I'll literally be asking my patients, like, did you feel like a little bit more moody this week? Did you feel nipple sensitivity? And then as soon as I'm asking them these questions, it like rings a bell.
Yeah, we asked people today the same thing.
Exactly. And
but I don't even think they know. I think that's the issue too, is the unknown. Mm-hmm. These people don't know. They don't know what to feel. And they're also, I think the biggest thing with our patients, and you can probably agree, is, it's been 4 weeks. When am I going to feel amazing? Like, it's a 7-day ester. So really, if they don't understand half-life of drugs, which
Definitely.
most people don't, I didn't know what it was until you get educated. Mm-hmm. it takes 30 days to get stable in your body. So that's the biggest issue with people. Like, oh, when am I going to feel great? My libido hasn't changed. I haven't lost any weight. And I think that's another one thing is that for me, being on testosterone, my midsection's been trimmed up, but I've been on it for over a year now through here. So that's obviously a long time, but it
Definitely.
It does, is my biggest thing.
Helping with lean muscle mass growth is one of the greatest benefits of starting on testosterone. I think a lot of people ask these questions, like, when am I going to feel good? When am I going to feel the great benefits? And I just love to educate patients on that. Like, just like anything, you're going to feel the results over time. So it's not like an overnight fix with testosterone.
Yeah.
We treat very conservatively here. So we're not going to give you these crazy doses that you're going to be feeling amazing tomorrow. But our goal is just to optimize your numbers, making you feel like the gradual difference in a safe way. But our patients are having like the best benefits. I mean, somebody came in yesterday just describing like, I feel awesome. Like, I'm so happy I stuck with this. Like, this was worth it.
Yeah.
And then just going over these responses with the patients have been.
And I can say awesome. For myself, because I've done, my dose was 120, then I went to 140, then I went to 200. And like, I'm like, oh, 200, I took steroids when I was younger. Mm-hmm. I did 200 every day,
We're not doing that anymore.
But now 200 is too much for me. It is. My good dose is 160.
Exactly.
And that's what I'm on now, 160 milligrams. It's crazy, but like 200, it's just, for me, I'm too high. And I was like bloated and I didn't feel right.
Definitely.
So
that's a good point. Like, I like to talk with my patients about where they feel the best. So it's not about just ramming up this number. And if your blood work's good, then we're going to bump you up. If your blood work's good, then we're going to bump you up. Of course, we're going to do that while your body is tolerating it fine. But really listening to your body and understanding, like, this is where I feel my best at. Yeah. That's where we're keeping our patients at. So that number, whatever it may be for you specifically, is going to be different for somebody else. But that's why we have weekly meetings. That's why when you come in for your appointments, we're going over everything. We're seeing how you're feeling, how everything's been, monitoring blood pressure, monitoring blood work, just to make sure it's safe.
What do you think about guys and I know we do a lot of like younger guys that want to have kids that take enclomiphene with testosterone?
Yep.
Let's explain that just a little bit, because I know we have a few patients like that, so you can dive into that, because I don't really know about that stuff.
Yeah, so one of the biggest concerns I have from my patients, they think their balls are going to shrink on testosterone. So I love to go over this with my patients. Like, this is a common thing that may happen. Testicular atrophy.
It does.
Is the medical term for that.
Okay, yeah.
So
your balls are going to shrink.
Will you have testicular atrophy on testosterone? Yes, that can definitely happen, which may be a concern for many men. Starting on enclomiphene while taking the testosterone replacement therapy is going to be your answer. That's going to help you. It's going to reduce that testicular atrophy, and it's just going to overall make you feel a little bit more well managed with less side effects.
You think that spikes their testosterone that much more than just TRT by itself?
So what TRT does is it replaces the testosterone. And then what enclomiphene does is it boosts your natural production. So it kind of is an adjunct therapy. They can really, really complement each other very well, because it's letting your body not completely turn off that natural production while still getting your body to keep going with what it has.
Awesome.
I think that's a great option.
Awesome. Okay, let's talk about weight loss. GLP-1s, side effects, I think, are the biggest thing that patients come in and ask us. I don't want side effects. GLP-1s, semaglutide are probably number one seller for weight loss. We also have phetermine, which is probably prescribed 5% of our patients that. But let's talk about semaglutide first, how it works, etc.
So how does semaglutide work, and what is semaglutide? So what is a peptide? So many people have this question. When I start explaining this, everyone just interrupts me and says, what's a peptide? So I like to explain peptides are just a short chain of amino acids in our body. We already have all this inside of us. What a peptide does is it comes into our system and it helps bind these short chains together. So it's going to act quicker. It's going to give us great benefits. And basically, it's just going to give our body what it needs. So semaglutide is probably the most popular service we do here in the office. It is going to be a peptide that helps with weight loss. And what semaglutide is you may have heard of it. There's tons of brand names out there for semaglutide.
Yeah.
Everybody's heard of them. Like, your next door neighbor is on this.
Everybody's on semaglutide.
Every single person is on semaglutide. So you've heard of all these brand names. The companies have, there's commercials. You've seen them all. And I think a lot of people are scared of them. A lot of people are scared of the side effects.
You know what it is? I think a lot of people are scared of, I don't know the side effects, but GLP-1s have been around since 2007. Almost 20 years. And semaglutide was developed in 2017. So that's almost, we're at what, 8 years?
Yeah, they're not
So
brand
they
new.
know the side effects. We know the side effects, and that's a big myth is, oh, we don't know the side effects. I don't want to be dead in 10 years. And that's actually a great anti-aging drug. Don't you agree? Like, it's a great anti-aging drug.
Great. I always tell my patients, like, reducing the risk for cardiovascular disease, obesity, all of these things are going to be so beneficial for you. Getting this extra weight off of you, extra weight around your organs, stubborn fat that's just not willing to leave, getting all of this off of you is just going to help you longevity-wise. So I would stop being scared of the side effects of semaglutide.
I think it's way overblown.
Definitely.
It's those commercials you see on TV, it's all overblown. What do you think the number one reason people lose weight from semaglutide?
So semaglutide is going to curb your appetite. So that is my favorite therapeutic benefit of starting on semaglutide. You're just not going to be thinking about food all the time. So you're not going to be thinking about your next meal, what you're cooking for dinner, what's for lunch. You just start to kind of turn off that food noise. So you're not going to be starving and craving all of these foods anymore. It really has a very strong mental aspect to it that a lot of people don't realize. You're going to feel fuller faster. You're going to not want to eat as much. Overall going to be benefiting your intake and allowing you to make healthier decisions and really listen to your body. Like, hey, I've had enough. I don't need to finish all of this.
Yeah. And I think the biggest thing is you have to give it 90 days to work.
Definitely.
It's a 7-day half-life, like we tried to talk about half-lives before.
Yep.
So it takes that long to get stable. It's a month. You have to give it a month to even be in your body. And I know you explain this to everybody, and there's so many people that are like rushed to say, oh, it's not working. I don't want to do it anymore.
Yeah.
It's been a month. I haven't lost any weight. And I think you can agree. We see patients that sometimes they lose 7 pounds their first week, hits them instantly. And then you have patients like they don't have any effects until 60 days out, and then all of a sudden they lost 8 pounds that week.
Yeah, so this is actually a really good topic. A lot of patients are on this path to want to be losing so quick. So if we lose weight really fast, our body just naturally goes into like a shock.
Yeah.
It's trying to hold on to things. We may have hair loss. We may have different kind of side effects. So I always like to say steady is the way to be with the weight loss. So our goal for all of our patients, 1 to 3 pounds a week. We're doing this slow, we're doing this steady, and we're doing this control. So what we're going to be doing is having a goal of 1 to 3 pounds of weight loss per week. As long as we're hitting that, we're going to stay at that dose. If you're losing on a low dose of semaglutide, there's no reason we're going to bump our patients up. So I always say the lowest amount of drug with the best amount of side effects, that's right where we're staying.
Hair loss, like I know, and you say hair loss, so I don't think we've had many patients with hair loss. I think
We
we've had
really
a couple.
haven't.
But you think it's the lack of nutrients? I think that's probably the main reason they're losing hair is because they're not eating. And I know the biggest thing with this drug, and I've done a lot of research on my own, and Katie has too, that you have to eat. Like you have to force protein, 1 gram of protein per pound of what you're trying to achieve. So if you want to be 120 pounds, you got to get the 120 grams of protein. Protein's ideal. You have to eat. Even if it's chugging a protein shake, you got to get your protein and you got to get your vitamins. If you don't get your vitamins, your hair's going to fall out, your body's going to be malnourished.
For sure.
And you're going to look terrible.
So 2 different things with that. Definitely the vitamins, nutrients, and minerals you're going to be depleted of because you're not eating as much or the things that you used to. So that's going to cause hair loss. It can. If we're not eating the normal things, our body's not getting those essential things. So definitely that. And then the second one being rapid weight loss. So if you're losing a ton of weight fast, your body may try to hold on to things and it may act in shock. So it may have hair loss as one of the side effects. So fixing those 2 things, eating a ton of protein and doing gradual weight loss is really going to just debunk that myth completely.
And then I think the other myth is I take it and I just lose weight. I think and we tell everybody, I hear your consultations, you have to work out, you have to move. Even if it's walking, it's just you gotta move. It's not a magic drug.
Definitely.
It's not a magic drug. Explain that.
Lifestyle change.
Correct.
So starting on this peptide is going to get you the results that you want. So I do have patients coming in here and they're honest, like, Katie, I'm not going to work out. Katie, I'm not going to diet. I just want to get this. That's great, but we want to sustain this.
Yeah.
We want you to eventually get off of this. We want you to be at a healthy weight. We want you to be strong, lean, healthy. So I always, always, always educate on the importance of lifestyle changing. So starting on the peptide and then definitely getting in your protein intake. You said it perfectly, 1 gram of protein per desired body pound. So a 120-pound woman should be eating 120 grams protein a day. That with strength training. So strength training is huge on peptides, especially on semaglutide. Your body just naturally gets a reduction in your muscles while you're taking semaglutide. It kind of attacks those good muscles that you have. So strength training. A lot of my patients ask me what strength training is.
Yeah, I agree. And I think another thing is you can't tell somebody how much weight they're going to lose, because I know you see it. We have patients that don't work out, that still eat like garbage, and they're down 60, 70 pounds. And then you have somebody that hardly eats, and they're not losing weight. Everybody's body's different, and that's what they have to understand. And I think maybe so you can touch on the insulin resistance and how this works with people's insulin resistance and how it makes their glucose and all that A1C go down, how this drug was made for diabetics, and they started noticing, oh, wow, people are losing weight. So can you maybe touch on that for people? I think that's a big thing, because people think they're going to lose weight no matter what they do. I'm working out, and then it doesn't happen.
Definitely. So to touch on what you said, first of all, the people who aren't taking protein and aren't working out. So that's where you get this skinny fat or Ozempic butt, Ozempic face. We've all heard of these things. So that just has to do with that rapid weight loss where people aren't doing this the correct way. So they're losing too much weight too fast. They're not eating enough protein. I mean, you can literally see somebody in the gym. Like, that person's on.
When you see that person's on semaglutide. Well, you can
tell.
I think 1 out of 10 people, if you do, out of 10 people, 8 of them are on semaglutide.
And their bodies just kind of look depleted. Their muscle isn't there. They just don't look strong, healthy. They just look skinny. Yeah. So that is not our goal. Our goal is not to be skinny. We don't want to be skinny fat. We want to be lean. We want to be strong. We want to be healthy. So I think explaining to patients why they need to take the protein, why they need to work out, why they need to actually put the muscles they have to use is really beneficial. A lot of my patients didn't understand that at first.
And what do you think about coming off semaglutide? Are they going to gain all this weight back? Are they going to have to stay on this drug forever? I've done a lot of research, and listen, no matter what you do, when you come off it, you can change you're still going to gain a little bit of weight back because your insulin resistance changes. It's going to go back to normal. So touch on that, because I think a lot of people want to know, do I have to stay on this drug forever? Is it bad for me? People think, oh, I can't stay on this forever. I can only do it for 6 months, but this drug is made to stay on forever, correct?
Definitely. So we have had patients on this for years. So semaglutide is something that's sustainable in the body. You can stay on it. I really love to talk about microdosing of this with my patients. So once you reach your goal, you're where you want to be. You feel good. You feel like your diet's under control. You've got the working out under control. You're at your goal. Let's talk about titrating down on the medication so that you're not getting as much as you used to need. And then just talk about kind of plateauing and just maintaining. So microdosing semaglutide to help prevent inflammation, to help with food reduction, that food noise, is a great alternative when you kind of reach your goal and you just want to maintain.
Yeah, let's say, so we have a patient on semaglutide, they can't handle the side effects. They want to try phetermine. Let's talk about phetermine, side effects, that good stuff. What's your thoughts on phetermine with people and with their weight loss they're going to get?
So first of all, if you can't...
What is phetermine, right? Explain it to me, because I don't even know that much about it, because it's not really, we really don't give a lot of people it.
So let me just say that the side effects of semaglutide are treatable. So nothing is going to make you feel like you can't get out of your house and work that day. Everything's treatable. Your nausea is treatable. Your constipation is treatable. Your diarrhea is treatable. Any of the symptoms that you may be having on semaglutide are usually very quick, short-lived, and treatable. So I always like to explain that. It's not something that you should be really scared of. But
there's people that are, I'm done. Yeah. So, hey, let's try phetermine. How does that work versus semaglutide, and what are the benefits maybe, or not the benefits,
So one benefit of taking phetermine is you're going to be doing this on your own at home. So this is an oral medication that you can just take. It's going to help reduce cravings, help reduce hunger, and it's going to be acting like a stimulant. So you're going to be more energetic, more focused, and it's just really going to help you get your food noise under control.
Okay. And we do have pharmacies that will ship both drugs to them if they're out of state, if they're not local. Katie can do an online consult. on the phone, and that can be shipped directly from our pharmacies. They don't ship to every state, but I think they're almost like 40 states now. And that's another great benefit for people that aren't local, or if they were local and they were patients and they move away, or they're, we can
work with you.
Work with it.
What do you think about phentermine? Do you think our patients are loving it?
I don't know. I think our patients that like it because it's more like an Adderall almost. It's in that family. It's a stimulant. So people that like that stimulant, they think that's what they like about it.
Yeah.
But I don't know if I've had anybody that's like, oh, I lost 20 pounds off phentermine. I don't think the weight loss is as drastic.
For some people, the stimulant really helps them because they're just not thinking about food a lot. They're on to the next activity. They're just really feeling energetic. So I have had patients lose 20, 30 pounds on phentermine, but I do feel like people plateau on that one a
and
little
maybe
bit.
I don't hear about it because it's so, there's not very many, and I don't pay attention to that.
Yeah.
Because it's mostly I hear, oh, I'm down. I lost 8 pounds. We had somebody today that came in, they're on their 3rd week of semaglutide, and they're down 8 pounds. I was like, wow, okay.
Yeah, you hear more about that. It's just quicker. I feel like our patients respond better to the semaglutide.
Yeah, for sure. We also have weight loss peptides that are different than semaglutide as far as AOD 9604. There's a whole bunch of them.
CJC.
5-amino-1-MQ. Let's talk about those kind of peptides and how those work. And also there's muscle building peptides, GH peptides, sleep peptides. There's probably 5,000 different kind of peptides out there, but the main ones, like mainstream ones you hear about now, healing peptides, BPC. Let's go that way now, and talk about those. What maybe our top 3, how they work.
Definitely. So there's truly a peptide for everything.
There is.
Like if you come to me and you're like, Katie, I can't sleep, there's a peptide to help you sleep.
Yeah.
So I feel like a lot of people don't know a lot about peptides. So just letting the public understand that there really is a peptide for everything. So the introduction peptide, I would say, like the intro to peptides, the gateway peptide.
BPC.
BPC.
Everybody knows BPC. And I think you're right. That's the gateway peptide because
really
I think that's our number 1 seller here. And now there's BPC oral, which is a huge seller, which is for your gut. They both do different things. BPC injectable helps heal the tendons and muscles, and you can touch on that. And I think the BPC oral there's TB500 now for your gut. There's KPV.
Definitely.
We could keep going.
Yeah,
There's
so
a million of them.
BPC is like the mainstream gateway peptide. So starting
Yeah.
with that one, so good for muscle repair, tendon repair, ligaments. It just goes systemically exactly to where the injury is. So people like this one if you're in the gym, you're sore. If you're feeling muscle soreness after working out, if you had a surgery and you're looking for a quick fix, BPC is going to be awesome. You're going to inject it with a tiny insulin syringe systemically, like I said.
You can show that little thing. It's so small you could stab somebody.
Nobody's scared of this.
It's so small.
So stabbing this in your stomach, usually we do 5 days a week, 2 days off, going to help you so much with muscle recovery, repair, tendons, ligaments. So I love that one. And then BPC also, like you mentioned, orally with KPV, it's going to completely heal the gut. So anybody that's having IBS, different kind of stomach, gut issues, KPV with BPC orally, awesome combination.
And I think the number 1 peptide scripted is sermorelin.
Excellent. I love sermorelin because it's not just one thing that it does. There's so many benefits to being on sermorelin. What do you think about it? I know you've tried it.
I'm on it. I take it every night. I've actually switched to CJC IPAM now. And the difference, I don't know. I think I've been on sermorelin so long. They're almost the same drug, if you ask my opinion. But I think it's a great drug. And maybe you can touch on how it works. It's the HGH peptide. Totally different than BPC.
Definitely.
We don't want to confuse people.
Yeah.
They're probably already confused because if you know a peptide, you know it. If you don't, people are like, what is a peptide?
Yeah. So the sermorelin with the HGH factor in there, really just going to help that human growth hormone, really going to just benefit kind of your natural production of it. And then
it stimulates pituitary glands. So you're never going to make too much.
Exactly.
It's not like taking HGH at all.
No, it's just going to help give your body what it needs, what it's replenished of. So I love this one for patients. Sermorelin probably has the best benefits on our patients here.
I think peptides right now are the biggest thing out there. I think that's the most talked about new anti-aging drugs are peptides.
Definitely. GHKCU for females. Like, this is the number one thing I'm talking about with my friends, with patients. Every female should be on this one. So you can get this one topically. You can take it injectable.
I put it all over my face every day. Can't you tell?
It's going to make your skin shine. It's going to give you that collagen production.
Yeah.
It's going to help with hair.
Anti-wrinkle. It's great. You can inject it. You can put it topically. It is the biggest thing. They have it orally now too.
Yeah, it's amazing.
I think that's a huge one. And then you got the TB500 BPC injectable. We forgot about that one. That's the Wolverine stack. That's probably the number one talked about healing stack for guys that tear muscles or
want to build muscle.
It just is the ultimate Wolverine, makes you a beast, right?
It's going to help you with everything. It's going to help you heal. It's going to help you grow.
Correct.
It's going to help you just be a beast in the gym. So we love that one for like bodybuilders, for patients who are looking for kind of like an all-in-one. We'll just do a stack for them with that one.
Yeah, perfect.
How about MK? What do you like about that one?
MK677 is probably like one of our best sellers. It just happened to be. It's guys that can't gain weight, stimulates appetite, bone density. What it does is it stimulates a ghrelin in your pituitary gland, which makes you hungry, which makes your HGH go up. So it's great for sleep too. Great for hair growth. It won't make your hair grow back, obviously, but it makes your nails, your hair grow faster, skin better, all those kind of things.
So people who kind of just can't eat, like I always say, this is a good one for them.
It's probably the best one to gain weight off of.
Definitely. Just makes your hunger go up, makes you get those calories that you need.
Yeah, we have a patient here, and we'll talk with him about his experience with it, and we'll go from there. So, Katie, what do you think about patients coming in for their shots? I think that's our specialty here, that people like coming in not just for testosterone, but weight loss, and that makes us almost stick out because if they have any questions, when they come in, they take their blood pressure, we weigh them, we monitor them. They can, ask anything. If there's any issues, they can come in and talk to you directly or one of our nurses. I think that's a big reason why people come in because, the average guy doesn't want to do their own shot. The average person's scared of a needle, even though it's little, even testosterone. When you associate testosterone and weight loss with the needle, people always associate bad drugs.
Intimidated.
Oh my God, I'm intimidated. It's a needle. I'm scared I'm going to pass out.
Yeah.
So let's touch on that real quick. What the benefit is of coming in here.
So I think having somebody to talk to, like a face-to-face person, I'm listening to you, I'm hearing your concerns. I'm going to tell you what I think. We're going to go through a plan together. That's just the biggest benefit of coming into here. Coming into a place where people are educated, if you have something going on, they'll be able to help you. They'll be able to fix it. You can literally pick up the phone and call us. Hey, Katie, I was feeling this day. Is this normal? Like there's somebody here. There's an educated person on staff here that's going to help you with your symptoms. So yes, you can order semaglutide on foreign websites from China and other countries that I don't know what's in them. But do I suggest that? No.
You can also order it through a telemedicine company, but then that's it. You have it. You don't know how to go.
You're on your own.
You're on your own. You don't know when to increase your dose. If you get side, you don't know who to call.
Yeah.
You can call. Hey, you always tell them, hey, if you have any issues, sick, you don't feel good, call us. We'll prescribe Zofran.
Right away.
I'll do it right over the phone for you.
Yep.
You don't get that online.
Definitely
Here you
not.
get that. If you have any issues, Katie's going to take care of it. Katie's not here. I'm going to text Katie. Katie, this person needs Zofran, and Katie gets it called in.
I think that should be really calming for our patients. Like you're not just going home with this stuff and we're like, hey, see ya. I hope it works out.
Yeah. Good luck.
You're here. We're monitoring you. You're on our protocol. We care about you. We want to make sure you're feeling good. So we're not going to just leave you hanging.
And I think the bigger thing is too, like dosing. People don't know how to dose this drug. Any of the drugs, to be honest.
Yeah.
They wouldn't know what to do.
Yeah. That's one of the biggest things, I think. Like patients are always asking me, how many units do I take? What about this? When do I go up? When should I stop? When should we go down? So we have protocols for all of that. So
I have people message me, which is funny because I got it from this pharmacy in Florida. I don't understand what 20 units is on my syringe. How do I do this? I'm like, let me see your bottle. Let me talk to Katie. She can look at it. But this is why you don't order telemedicine.
Because 20 units on ours is different than 20 units on somebody else's. So it all has to do with the dilution. So I have patients all the time asking me well, I used to be on 20 units of this.
I hear it all the time.
It's like my biggest
You're like,
ick.
what milligram, not units?
It's my biggest ick. Don't tell me the units you were on.
Yeah.
This just really screams that people aren't educated on the topic. So if you don't know the milligrams and you don't know what's going on, just go to somebody who can tell you what you're on, what the ingredients are in it, and we can tell you how many milligrams you're actually taking. It's just the safest way to do it.
Yeah, I agree. I think that's the benefit of coming in here is It's one-on-one. If there's any issues, Katie or the nurse takes care of it, and that's it.
Yeah, our whole staff is educated on this. So we've all done training, certifications. Everybody knows what's going on and what's going into your system here, so no one's going to have any questions.